Good morning, everyone. My name is Maya Luria with TMC for Seniors, and today we are going to be talking about the mood-gut connection. We are working on mental and emotional health this month, and I think that you'll be very interested to hear more about how your gut may affect your mood as far as everything that you are eating. I've got Mary Mellady here with me from she is from TMC, and she is the director of Connected Health and Wellness. So welcome, Mary.
Good morning.
You always give us a great presentation, and I know that this one is very different from any of the other ones that you've done before. So we're really looking forward to hearing more.
Oh, good. Me too.
So, all right.
All right. Well, as Maya knows, this was a little stretch for me. This is not my area of expertise, but it was very interesting because there's a lot of stuff out there about our gut and how that connects to our overall health, including our mood. And there's that saying, listen to your gut, you get that gut feeling. You know, that we've been using that saying for a long time. I think science is finally catching up to it as to why we should be listening to our gut. So there is this kind of behavioral health issues and our mood, and whether we're talking about some clinical diagnosis, or we're just talking about we're just not feeling in a good mood. We talk a lot about that, and it's often a topic of not much debate as to are we trying to treat a disease? Do people just need to get over it? How many times have you heard, oh, just get over it, you're fine? And that's something men never say that to women, but we should just never say just get over it or take a pill, because there's much more, there's something deeper there. And unfortunately, until recently, all of this kind of behavioral health, mental health, psychological issues, we couldn't just be diagnosed under a microscope. And doctors have been searching for a lot more concrete answers and treatments and options. And perhaps that's why the concept of this gut-brain axis. So that's this picture that I'm showing here, this connection between the brain and the gut. The more we're learning that there's actually a scientific connection between our gut, our GI system, and our brain. It's taking us all by storm because we're actually looking for the answer. How can we help ourselves more than just having to say, oh, just get over it? So especially now when behavioral health issues are on the rise and our mental well-being has really been pushed to its limits over the past year. Some of the stuff that's coming out and some of the stuff that I'm hoping to share with you, it's really, it's exciting because there's some answers, potential answers that might be very beneficial to some of us. Oops, sorry, I went too fast there. All right, so what is it when we hear the word microbiome? It's our gut microbiome. So and you also might hear microbiota. So depending on what you're reading or what you're listening to, you might hear either the microbiome or the microbiota. So this is just the community of all those living bacteria, the fungi, the viruses, of these microorganisms that live in our body. And don't be too grossed out. They live everywhere. They live on our skin. They live in different parts, you know, but for the most part, they live symbiotically with us. And 99% of this microbiome, this microbiota, is made up of bacteria. And so they serve a purpose for our body. Why am I not clicking forward here? Sorry, you guys. I'm on a different computer today. There we go. So we have these little microbe communities that live in nooks and crannies throughout our bodies, like I said, in our hair, in our ears, nose, on our skin and our fingernails. And so some of that stuff that lives on our hands, we wash, because that bacteria, not good. But the largest microbial community lives in our intestine, and for the most part, we want it there. The healthy bacteria and organisms that live there do some really good things for us. There's over 100 trillion different types of microorganisms that live in our large intestine. This is the most diverse community of different species of bacteria that live in and on our body. So we want to promote that and try to keep that healthy. So the first inhabitants of our microbiome, of our gut, come from our mom when we are born, and that just overall general birth environment. And so this connects to something I'll say a little bit later. But so we get a lot of our different microorganisms from our genetics, from our mom, from our parents. And this community grows over the first 3 years of our life. And that's from introduction of different types of foods. Babies stick stuff in their mouth. Moms stick their hands in our mouths when we're younger. So this creates that building of that bacterial microbiome when we're young. And each person is different. So I have a very different microbiome from somebody that is sitting next to me, or even from my own sons. But part of it is our genetics. Part of it is our environment. So when I said about what comes from the birth canal, so this pre and postnatal environment. So what we're living in when we are being created and formed, what we come through when we're being born. We bring all of that with us, and that helps to create the different microbiomes on our bodies and in our gut. It also is very much related to what we eat and what we drink. So diet has the largest impact on the makeup of our gut microbiome. And that is based on breastfed versus formula-fed infants have different microbiomes, just because there's different things in both of those. Think about if an infant is breastfed, they're also getting some of the bacteria that might be on the skin of the mother's breast. Biggest changes occur when we introduce solid food, probably because there's different things in those solid foods, not saying contaminants, but just different organisms are involved in solid foods, as well as how do infants learn to eat? It's generally with their hands, and infants' hands aren't always the cleanest as much as we would like to. But that's okay, because we want those different bacteria to be introduced into our kids' lives, because that creates all of these different microbes in our gut. And microbes appear to have favorite foods. So people from different origins and regions have different populations of microbes based on what they eat traditionally. So somebody, again, when I said I have a very different microbiome than my son, if he's traveled a lot and had different foods, or if I live in a different part of the country, that gives us different populations in our gut. And then diversity and richness of microbiomes unfortunately start to decrease with old age. As we age, as we incur more decades in our life, our microbiome seems to decrease, seems to not be as rich. This might be related to changes in our diets. As we age, our diets do change, and that might be related to we just don't have the same, our taste buds actually change, physically change. And we might have some different abilities to chew different textures, or we just might not have access to the same types of foods. So that changes our diet. And this is possibly related to some of the increases in our disease processes as we age, or the disease processes may have altered the types of food we eat too. Again, back to our dentition. We might not be eating as much raw foods as we used to. if we don't have as great dentition as we did when we were in our teens and 20s. This also might be related to our lifestyles too. We might be less active when we're older, and this can also influence our gut. And then the decline of our microbiome is, as I said, related to sometimes a decline in our health and an increase in some of more chronic diseases that we see as we age. So what does the microbiome do? And I am going to get to the whole how it connects to our brain. So I just wanted to give you a little overview first. Our microbiome helps with digestion. So those little microbes that live in our gut, they eat and help to digest some of those complex carbohydrates that might be otherwise indigestible for us as humans. They help to create vitamins such as vitamin K, biotin, and some of the other B vitamins. And they help in the production of short chain fatty acids. So those in the digestion process, in what they're doing to create vitamins, they are helping to create those, they fuel these colony of cells, these that help to produce the short chain fatty acids that actually help with being anti-inflammatory. The gut is our largest immune organ. So think about what we eat, or anything that enters our body through our mouth eventually travels down and ends up in our gut. So a lot of these micro organisms help to pull out bad things and act as a barrier. And so that's how I'm using it as an immune organ. The good microbes in our gut crowd out the bad ones. And so when we think about things such as C. diff, which is something that is a bad organism that can cause diarrhea, the higher amount of good bacteria that we have in our GI helps to push out those bad ones that would cause things like diarrhea from the C. diff. It also helps to create antibacterial compounds to fight the bad bugs. And these healthy microbes help with reducing the inflammatory responses. So an overabundance of bad microbes is linked with inflammatory diseases such as inflammatory bowel disease, diabetes, and it seems that there is a connection if our gut is overrun with the bad microbes, that they tend to absorb more calories from food, and then that is linked to obesity. So these little guys, these good microbes have a lot of functions in our body that are very beneficial to us. So when we're talking about this link to our mood, this neurological link, the idea that our brain and our gut or our stomach are connected isn't new. So how often have you thought about the idea that when you're stressed out or when you're really anxious, your stomach is kind of upset? You kind of have an acidic stomach. Or when we're not feeling great, and we have those comfort foods. I don't know if you've ever been to one of our other talks. Lori and I would always refer to, Ben and Jerry's or, whatever as our comfort foods, that we want to find other comfort foods, that those unhealthy foods make us feel better. Why is that? Why do certain foods make us feel better? And then our appetite, sometimes we notice changes during major life events. Have you ever noticed that, here's a good example. The dad that puts on, that adds the pregnancy weight with the wife. Well, he's not really, it's because he's probably stressed, and so he's eating more. Or somebody that on the other side that might be going through something very stressful, such as losing a parent, their appetite changes might be, they might not have an appetite at all, because that stress is related to what they're going through in their life. So this is how we get this idea of what our stomach is feeling, what our gut is feeling, is really influenced by what's happening up here in our head. But maybe we don't make that connection necessarily. But there is some science behind it. So there is a link between the health of a mother's microbiome. So remember back when I said our microbiome can be created and made up of and influenced by that what's in the birth canal from our mom, or what's on our mom's hands, things of that nature. So the health of the mother's microbiome is linked to development of psychiatric disorders later in a child's life. Stress response, which comes first, stress or the unhealthy, the microbes. So stress can disturb the microbiome and impact digestion, right? So when we're stressed, our stomach, like I mentioned before, isn't acidic and we don't digest food as well. Might feel a little more bloaty, something of that nature. But some studies actually have shown that a healthier microbiome, so if we're eating a healthier diet, we have a healthier gut, can decrease our stress response and inflammation in the brain that helps us think through things a little bit better. And so therefore, maybe we handle stress better. So maybe if we have a stressful event happening in our lives, if we really have focused on eating a healthy diet and we have a healthy gut, studies are showing that people's response in similar stressful events with a healthy gut, they don't have quite this quite as enhanced stress responses as those that do have a healthy gut. So depression, and the idea that rat studies correlate depression with healthy microbes. So what they have done in some studies is that there is an increase in depression in people taking, so think about this, rat studies first, is that when they have transplanted the microbiome from a person with depression and put it into a rat that has had normal behavior, that rat starts to exhibit behaviors that would be associated with depression in the animal species. So let me repeat that. So there are studies that they have had taken some bacterial microbiome out of a human with depression and then put it into a rat that has otherwise been normally behaving, and now they start to exhibit signs of depression. So that's how they're starting to link that unhealthy gut with these, with the idea of it linking to depression. Another thing to think about that they've seen studies is that that there is an increase in depression with people that take antibiotics. Now, it's pretty commonly known that antibiotics can have a negative impact on our gut, and that's why a lot of the times you hear if you're taking antibiotics, you should eat more yogurt or eat more fermented foods because that helps keep our gut healthy. And that's very true. But the same effect does not happen for people that are taking antivirals, because and antivirals don't have an impact on our gut like the antibacterials do. So there is that interesting link that that we have seen. Okay. And then gut microbiome is correlated positively with impacting mental health, but the exact mechanism is not fully clear. So we know that there's a connection. We just don't know exactly what it looks like. And there's this whole new field of study called nutritional psychiatry, where we're thinking we know, or we subjectively know, that when people eat different foods, that we're seeing these correlations. It's completely correlative now. It's not, there's not strong enough studies to show that it is causative. So while there's no clinical support for a specific diet to treat mental health issues, most studies show that there's a positive correlation between diets that are high in fiber, in those fresh fruits and vegetables and whole grains, like the Mediterranean diet, and improved symptoms of anxiety, of depression, and of even some things like autism and or schizophrenia. So doctors, psychiatrists are really starting to look to nutrition as an additional treatment in addition to the normal medications that they're using. They are also looking to nutrition as a way to help to lessen the symptoms of some of these diseases. So how exactly does this gut-brain access? How does our gut talk to our brain? There's a couple thoughts here. So gut microbes produce serotonin and other chemicals that enter our bloodstream through the gut and talk directly to our brain. So they're sending signals through this serotonin through the blood up into our brain. That hormones and neurotransmitters and immunological factors influence how our cells in our guts respond, that then also transmit information to our brain that tells our whole body how to respond. And there is something new they're looking at, that microbes might be prompting these neuropod cells. These are new types of cells that they have identified, and this is still not mainstream, but they think there's something called a neuropod cell in the gut that stimulates our vagus nerve. It's at the bottom of our brain, that connects, that tells our brain how to respond in many cases. This is a bidirectional communication. So this vagus nerve talks to our gut as well. So things are happening in both directions through this neuropod cells. Yeah, let me get to my next slide here. So in genetically susceptible people, we're seeing changes in the microbiome can weaken the blood-brain barrier. So in theory, this may increase the risk for depression or schizophrenia, OCD, ADHD, and autism. In mice, the microbiome appears to control spatial memory and anxiety behaviors. So again, is it the gut that's to blame? There's some correlation between chronic GI disorders and anxiety and depression. But then also we know that there's that reverse. So we know that psychological stress can also alter our microbiome. So that's what I was talking about, that bidirectional communication. And we know that there is a lot of new research coming out that is related to Alzheimer's disease and decreased microbial diversity as compared to people with dementia. So in both cases, somebody with dementia and somebody with Alzheimer's, we're still noticing that there's a difference in their microbiome even within those two groups, and definitely between somebody with Alzheimer's or dementia and a healthy subject. And then human observational studies also have shown different microbiomes demographics for people with Alzheimer's as well. So again, that this is just, sorry, lost my word there. Different, that they have different types of, the makeup of their microbiomes are different for people with Alzheimer's. So again, the diversity of the population and the number of microbiomes is what we are looking at. There is solid evidence that we are seeing that people with smaller variants of bacteria, of microbiomes, we see that in overweight and obese individuals versus those that are lean. So some evidence is showing that diets that are full of sugar and red meats and processed foods might change the balance of our microbiome and lean it more towards unhealthy and unhelpful bacteria than those good bacteria. Patients with inflammatory bowel disease have different gut microbiomes than those with healthy guts. And this is a whole nother talk, because inflammatory bowel disease has many other issues associated with it than just what we're eating. In mice, some bacteria increases production of antibodies and attacks the joints. So this is how we're seeing this bacteria, the bad ones, that are overriding the good ones in our gut, can influence other disease processes such as rheumatoid arthritis. All right, so how do we grow a nice healthy gut garden? So we have a pretty garden. We're going to use that as a good picture for a good gut, and then we have one that's sort of weedy and not very healthy. So first, let's talk about prebiotics. Prebiotics are the food that feeds our healthy bacteria. So in the cases that we have these healthy bacteria in our gut, we want to feed them. We want to keep them healthy, and we want to grow them, and we want to have more of them, of this healthy gut, healthy bacteria in our gut. So fiber from plants and fruits and grains increases the number of these species. The bacteria get to break down these fibers into these short chain fatty acids. The antioxidant from the plants we have shown to, or we've talked about, helps to lessen depression symptoms. Fiber from pills we don't feel are as effective. And again, we've talked a lot about that in other talks. Supplements don't always have the same impact as real food does, and we don't know exactly why. Is that because there's other aspects of the food that actually interact with the exact thing that we're looking for? So in this case, fiber. Is there other aspects of the food that are interacting that the healthy bacteria are using, and that's why the pills don't work quite as well? So we just don't know. So we always encourage people to get their supplements rather than from a pill, that we're getting it from real food. So prebiotics, healthy for our bacteria that are living in our guts. So it increases the diversity of our gut bacteria, and that creates a happy gut. Probiotics. Let me click here. Oh, sorry. First, we're going to talk about, I think I clicked one too many. Nope. Okay. So foods containing this fiber, and this isn't an exhaustive list, but this is just an example. Raw garlic, onions, and leeks, the Jerusalem artichokes, dandelion greens, asparagus, bananas, and seaweed. Beans and lentils, they don't have to be raw, they can be cooked. And then whole grains such as the wheats, the oats, the barleys are all great sources of fiber that are indigestible, that those bacteria in our gut like to digest and break up, that also provide us with some other healthy forms of bacteria. So the probiotics, healthy bacteria for our gut. These help to introduce different types of bacteria coming from fermented food. We mentioned that before when we were talking about the antibiotics. So fermented foods such as the yogurts, the kefir, tempura, kombucha, kimchi, miso, and sauerkraut. They must contain live and active cultures. So yogurt. When I say yogurt, I am looking for yogurt that have live and active cultures. This isn't things that are yogurt-like substances. And there's many yogurt-like substances out there. And I will say, if the yogurt looks like a dessert, it's not yogurt, it's a dessert. So if it's a red velvet cake yogurt, it's just, you might as well just have red velvet cake. So you want to look on the side of the yogurt container, and you want to see at least 4 to 5 different types of live cultures. And they will list them. If it's a good yogurt, they will list all the different active cultures that that particular yogurt contains. Supplements, if effective, probably most benefit the people with weakened microbe communities, such as the elderly adults, those that have been using antibiotics, or those that just kind of have overrun with bad microorganisms. So that's when probiotic supplements can be beneficial. So overuse of antibiotics, pretty commonly known. Antibiotics wreck the bacterial healthy community. They may not decrease, but they may alter the types of the population. And it generally takes a couple months to recover from that. Again, yogurt may help. As we talked about, it needs to have that active culture. Specific probiotic supplements may help to also reduce that antibiotic-associated diarrhea that we see when we've had a disruption in the microbes, or the microbial population, I guess. Artificial sweeteners may also affect our microbiome. So early studies in mice have shown that saccharin and sucralose alter our gut microbiome. The results could be that the gut microbiome extract more calories from food. So, and this could lead to increasing rates of obesity and or high blood sugars. With this altered microbiome that we might see related to in studies, early studies with the saccharin and sucralose, this might also alter and increase our fat storage, how our bodies are storing fat. And in a very small study, they showed these similar results in humans. So as I talked about before, that a lot of this is still in animal studies, and we have correlations. We don't have direct causations. We need to do more studies on humans and really kind of look at some what is more causative. But we have, I mean, there's just such great linkage in the studies that we do have, and they have done enough research with human guts to know that there is this connection between what we're eating, how healthy our gut is, and what's happening in our brain. So when we're thinking about if we're experiencing symptoms of depression or anxiety or stress or something even more severe, we should look to our gut first. What are we eating? And again, it's that question of what comes first, the chicken or the egg. I had this discussion with my husband about this. Is it the stress that causes us to choose different foods that then change and alter our gut microbiome? Or have we been not eating, making good choices around our foods that then leads us to have increased symptoms of depression, anxiety, or stress? Can it impact people with autism or schizophrenia or OCD, things of that nature? But in any case, nutritional psychiatry is coming, and it's on that forefront. And while there's no specific clinical diet, we know that eating a diet higher in fiber, in those fresh fruits and vegetables, whole grains, that are lower in processed foods and sweetened foods, that helps to improve the health of our gut, that it increases that healthy bacterial population, both in numbers and in diversity. And that is linked to improved inflammatory responses. So in other words, we don't have this dramatic inflammatory response like we would if we were eating a lot of processed and high sugar foods. That inflammatory response that happens in our gut can be linked to inflammatory process throughout our body that then can increase our risk for heart disease, for strokes, and also, it does impact our mood. So we do know that what we eat impacts our gut. We know that it impacts our inflammatory responses that we're having. And so that then can be correlated to this increased risk of these other diseases. So it's still so new. You're going to continue to see more and more studies and more research out there. And like with much of nutrition, it's such a young, growing science that we learn more always. And, you know, how often do we hear one thing and then something totally different comes along 5 years later? So it's because we're learning new things. I don't think we're going to hear anything different with this, with the mood-gut connection, or with this brain-gut access and this bidirectional communication between our brain and our gut. We're going to continue to learn more about how what we eat, what we put into our bodies and gets processed in our gut, the healthier we can be about it and the healthier we can keep our gut, the more likely it is that we are going to have positive impacts on how we're feeling emotionally and mentally. But to that point, we never know what is true, what is not. And so I wanted to provide you with some resources. Again, Lori and I and Zoe and anybody that gives a talk on here, we know that, you know, there's just so much information available out on the internet now. So when you're looking for what's true and what's just somebody giving their opinion, make sure you're looking for some pretty, you're looking at an organization, you're looking at a reliable source. So looking at places that are .org or .gov are good places to start, or looking directly on hospital sites too. Mayo Clinic, Cleveland Clinic have really robust patient education that even goes beyond what we have put out on TMC's websites. We're getting more information, and we're getting better about putting that kind of information out, but they have a lot of resources as well. But this resource right here has a lot of information about what's coming with regards to this whole gut-brain connection. And I just put up 2 examples. They have a lot of consumer-friendly, public-friendly information. So the 2 I just popped up here were effects of probiotics and prebiotics, and then what is a prebiotic. And these pictures are very terrible, so they weren't really meant for you to get information off of. But the link actually has a considerable amount of information. And this is information about this, our whole gut health. Okay. All right. So what questions do you have?
So thank
that
you.
I will try to answer.
Okay. So I did have a couple of questions that have come in. One was actually regarding pregnancy. So your microbiome and how healthy you eat when you are pregnant, are you then, does that determine or shape what your children's microbiome will be?
Yes, it does have it does influence. So one of the studies had shown that the healthier the mom's gut microbiome is, the healthier your child's is going to be, to some extent, because that can alter obviously by what that child starts to eat. But it does have an impact on how that child's microbiome starts to form. And some of the linkage is between that that child's initial microbiome and the likelihood of a psychiatric disorder later on in life.
Okay, great. Now, what if somebody has Crohn's or celiac disease? Would they have a weaker microbiome?
Yes, that goes along with the irritable bowel disease. That's a whole nother very specific gut that you probably, if you have one of those diseases, that you definitely want to be working very closely with your GI doctor. But never to say that eating a healthy diet, eating a diet that's lower in processed foods and sugars and things like that wouldn't be a good decision to start with.
Right. Okay. And how long does it take to start feeling the benefits of a healthy gut?
I think that's pretty individualistic, but I would think that within at least 2 weeks, you would start to notice a difference.
Okay, great. These were great questions that came
Yeah.
in that are it has a wide variety of different ways that we might be impacted by our microbiome. So,
yeah. It's if you have any interest in learning more, the resource link that I gave you has just a plethora of information, and it's really quite intriguing when you start really thinking about how often do we often say, "Gosh, I can't eat today because I'm really stressed out," or I went home and I ate a bunch of cookies because I had a really hard day at work, or I'm feeling really sad about this breakup or whatever, that you start to think, wait a minute, why are these two so connected? How what I'm thinking and what I'm eating. And then when you start to kind of dig through it a little bit more, it completely makes sense. So we just need the science to start to support what we all know.
Right. I loved hearing just about that nutritional
Psychiatry.
So,
yes, it's a thing. Yeah. So I really think that we're going to see, if we can get a lot more scientific human-based scientific studies, that what we're going to see is when a psychiatrist starts to meet with patients, it's not going to just be about, here's the pill that you're going to take, but here's the diet that you need to be following, because we need to get that gut health up as well.
Very fascinating. It really is.
Yeah.
So
really.
we will share Mary's presentation afterwards, which will provide you with that link as well. If anyone is interested in learning more, she provided a great resource there. So I will go ahead and send that out afterwards to anybody who was registered for this talk. If you are watching this talk later, please feel free to give us a call in the office over at TMC for Seniors. The phone number is 520-324-1960, and we'd be happy to email that out to you as well. So thank you so much for being here, Mary. I know this was a different talk for you, but very interesting and I think really, really helpful for everybody watching. Next month, we are all about women's health. So we look forward to several new talks then. And Mary, you actually have a talk that will be coming up on emotional eating. And that will be on Wednesday, May 12th at 10 a.m. That'll be another great topic for us, I think, as we get into, the emotional eating can be.
We might be talking about Ben and Jerry's again.
Yes.
Jerry's our friend.
Yes, exactly. So we look forward to seeing you then. Thank you all for being here today, and we will see you next time.
Bye.